to the cloud. And let me just do my quick introduction. And, you know, for anyone that's new, if you haven't seen our past webinars, you're in for a treat today. Dr. Hopkins has been a practicing ER physician for the past 20 years. He is currently a staff physician for the Dell Medical School at the University of Texas at Austin. He has collaborated with the leading researchers and physicians in the advanced diagnostic laboratory industry space and was instrumental in designing a diabetes awareness campaign. He has collaborated closely with the American Diabetes Association and the Joslin Diabetes Center. Welcome back. So happy to have you here. Let's just get right into the training today, because after what you showed me in the slides, I know people are going to have a lot of questions today.
Okay, sure. Yeah, well, thanks for having me, and hopefully you can hear me and see me okay.
Yep, you're good.
So I'll start by just sharing my screen, and we'll just kind of get going here.
Yep.
So let me just do that.
And I'm going to grab the link for people to go out for later on to find out the training that you're going to be talking about, because I know the question is going to start coming up as well.
All right, great. Now, so Carmen, you know, we started this company, yourlabwork.com, about a year ago, and really in January is when we first started, you know, our direct to consumer offerings. And your group was one of the first people that we went to. I think it was in March, actually.
Yep, I think you're right.
Yeah, because one of the things we wanted to do is we recognize the dramatic growth of health coaches and their ability to actually connect with people and talk to them about this resource. And we also identified it as a possible affiliate relationship for us, where health coaches could actually make passive revenue and help grow their practice by simply advocating for their clients. And so I want to kind of give you an update in how I see that health coaches are incorporating this into their own health coaching business,
yeah,
and how people are actually using it to leverage their own optimal health. So for people that don't know me, so I am an assistant clinical professor at the Dell Medical School right now at the University of Texas here in Austin. I'm actually in Oklahoma right now, but in Austin. I am a medical doctor. I got an MD degree from Loma Linda University Medical Center. I'm a board certified emergency medicine doctor, and I've also been fellowship trained by A4M, which is the American Academy of Anti-Aging Medicine. From that, I got hired as a consultant for some advanced diagnostic lab companies. And we did labs for, you know, some pretty interesting things, like the show NBC's Biggest Loser, where they would lose tons of weight, and we would actually measure biomarkers and the ones that, you know, would change with dramatic weight loss and health improvement. And we also did labs in the Oprah Winfrey show and so on. And so we were really sort of deep into the space of advanced diagnostic testing. And really, over the years of consulting for the lab companies, I realized that many of my patients in my own private practice, their deductibles began to skyrocket, and many of the costs were put into their own hands. And I found that lab tests were quite expensive. And so I thought, man, this would be cool if we could offer direct access testing to the public and actually help them save money. And so that's where everything started from. So some of the objectives that I want to talk to you guys about today is to understand what kind of lab testing options are available out there for your clients and for yourself and your family, and opportunity and how you can benefit, not only personally and your family can benefit, but also how many of your clients can benefit. And I'm just talking about pure financially, but there's also, I'm going to show you how they can benefit dramatically with disease interception. And I also want to talk about how to review results without stepping outside your practice. This is something, Carmen, you talk about a lot. I think you do a really good job with it. And, you know, as a health coach, you know, you're not the doctor. You don't have to figure out the complex medical condition and that kind of thing. So you don't have to feel that pressure, but you can advocate for your client. And some of my best patient outcomes come from people that really advocate for others. And I think it's a great thing to have great resources and a good education, you know, as a discussion point for your clients. So I want to give you some resources that you can potentially leverage to help you make you a better health coach. It'll just make you a better health coach and more in tune with your own health journey. And then also, you're going to have an offer today, because you're part of Carmen's group, to actually get the opportunity to purchase something that's really cool for your own self with significant savings. So we'll talk about that at the end. So for people who haven't seen this yet, this is my Aging Well wheel. This is something that we developed through years of advanced diagnostic testing and looking at the body's aging process. And so if you haven't seen this before, I just kind of want to just go through it really quick. So in the middle are the things that we tend not to be able to do anything about. We call these non-modifiable factors. We can't really control our chronological age. You know, we're all just getting older. we're born a certain gender and given certain genetics and a certain race. And to a large degree, you know, we're stuck with a lot of these things. And so when it comes to biomarker testing, we look outside of this non-modifiable factors. And there's five key pillars of aging. They're represented by these 4 big blue circles and the square to the outside, which is nutrition. Because nutrition is the key to everything. And I know you guys talk a lot about nutrition and how it's important to try to assess where your clients can best improve in their nutrition. We're all eating terrible. And unfortunately, it's dramatically affecting our aging process, and it's leading to a lot of chronic disease. Now, these diseases can actually be picked up before they become symptomatic. And so this is where advanced biomarker testing comes into play. So we're going to talk about each one of these key areas of aging so that you can understand how best to assess your own aging process. Because each one of us needs, you know, we need to know where we can improve. And so every person that comes and sees me, whether they're an elite athlete and they're just looking for a little bit of an edge, or they're somebody with a lot of symptoms, we plug them into this aging well wheel and we address these issues. And so we'll look at all these biomarkers, and then we'll take the year and focus in on those areas that need improvement. And so what a cool tool it is to be able to hone down to the area and the system of the body that really needs to be improved, because one system dramatically affects the other. On the outside of the aging well wheel, you'll see that these are really key things on the left side, on the blue, that we need to think about, particularly as health coaches. I mean, we need to talk to our clients about sleep. You know, are they sleeping enough? You know, sleep is so important. 25% of our life is spent sleeping. And if we don't do it well, it can really mess things up. And this is something that is, you know, kind of worn as a badge of honor by a lot of people, saying, well, I didn't, you know, I don't need to sleep, or I didn't get any sleep. And, you know, as a doctor, I remember we would always talk about how we could stay up for 40 hours straight and still go into surgery and do all these things. But it was just stupidity, right? Really, because our body needs that recovery time. And this is actually where we burn our belly fat, is in the deep stages of sleep. So it's not only about the duration of sleep, it's about the sleep architecture. It's about, are people taking sleep aids, which can oftentimes interfere with the sleep architecture? And are we doing the common sense things before we go to sleep to really try to help us fall asleep and to really get a good night's sleep? You know, are we cooling the room down? Are we wearing blue blockers, you know, a couple hours before bedtime? Are we eliminating electronics a couple hours before bedtime? Are we getting away from caffeine after 11 o'clock in the morning? You know, are we drinking too much water at night that's going to cause us to wake up in the middle of the night? So just sort of common sense things to visit with our clients about is so important because we're not sleeping well as a society. Stress, also a super important thing for health coaches to think about with their clients. Stress affects everybody. And unfortunately, it affects biomarkers in our body that can lead to weight gain, and it can lead to mood changes and all sorts of things. And so stress is super important. Of course, smoking, seasonal allergies, these are also very important to get our clients to stop smoking. And if they do have allergies, that can interfere with their sleep. So just getting those properly addressed would be important. And a lot of times it's just education. You know, if somebody's suffering with allergies, to let them know, hey, this can be treated. You know, you need to get it treated so you can get better rest. Social dynamics, of course, you know, if you're embarking on a health journey and you're trying to get your client to embark on that health journey, but their husband's totally against it or their kids are totally against it, and we don't take the opportunity to address it and really talk about how we're going to be successful as a family unit, we're missing out on an opportunity for a better outcome. And then, of course, everybody needs to have a physical activity or exercise program. If they're going to use their body, it's going to last longer. And so really try to talk to people about that. And of course, weight loss plan is almost always behind why people will come in and see me, is they generally want to try to lose some weight. And so weight loss is a key component for a lot of people. If we don't address these things on the outer part of the circle, and we don't take the opportunity to measure some of these advanced biomarkers and really intervene when necessary, we end up with all the diseases to the right side. And certainly as an ER doctor, I see this all the time. We have more early stroke and heart attack. I'm diagnosing more cancer out of the emergency room than I have before. Of course, we're seeing more gut problems and more autoimmune diseases. and respiratory problems. And all this is a direct result of aging inappropriately. So we're all aging faster than we should. And so when I used to see the stroke and heart attack, it would be in a person who's 60 or 70. And now we're seeing it more commonly in people that are 40 and 50. So it's really what's going on. It's a real sad thing because it didn't used to be this way. Over the last 20 years, our technology has gotten far better, and we can keep people alive much easier and bring them back from the death much easier. But why are they having problems so much younger? And a lot of it's linked to that pillar of nutrition. We're all just eating so horrible. So essentially, we as doctors need your help with health coaches to really connect with people and to approach people in a very comprehensive way. Because in doing so, you're going to make a huge difference in their outcome. All right, so this is a PDF that I like to give to people just to sort of give them a baseline understanding of the 5 key areas of aging well. And I'm going to talk about this as we go through this presentation, just to give you guys a background. So, one of the key areas is, of course, nutrition and nutrients. And so we're going to talk about the nutrients that improve metabolism, and we're going to learn about the 3 most common nutrient deficiencies. As far as hormones go, there's a lot of hormones that we can test, a lot of things we can think about. But for many women, thyroid is such a huge thing. There's over 20 million women are affected by thyroid disease. And unfortunately, if you're a woman, you're 10 times more likely to have autoimmune thyroid disease. So we're going to talk about that and how you can tell if you're at risk of developing thyroid disease before your TSH or your thyroid hormone tests ever start to move. Then I'm also going to tell you about my optimal thyroid testing levels so that you can know what those are if you want to write those down. And then healthy blood vessels, we're going to learn about the latest and what science has to offer in assessing these through biomarkers. And of course, this is really important to talk to your clients about because many of them have never had this test done before. And it's super important for everyone to get an advanced lipid panel at least once in their life so they can learn about what the risk is. Inflammation, super interesting area of aging. We think a lot of chronic disease is associated with inflammation. And so do you have evidence of chronic inflammation? Because we do know that if you have chronic inflammation and your levels are high enough, that is a completely independent risk factor for developing early stroke or heart attack. So what are these labs that we'd like to look at when it comes to inflammation? So we're going to talk about that. And then metabolism. What are the essential lab tests for metabolism? We're going to introduce those, and we're going to talk specifically about insulin and how it impacts weight loss and disease progression. And then how can we can actually measure these things that impact weight loss. And then I'm going to introduce to you my optimal levels for insulin so that you guys know about that. So let's talk a little bit about direct access because this is a huge thing for your clients. And the reason why is because in the past it just simply wasn't available. And back then, if a provider felt like a test was necessary, they would order it, and there was some partial coverage by insurance once the deductible was met, and the cons really weren't all that bad decades ago because patients really just didn't know a lot about lab tests. And nowadays, the biggest thing that I see is that a lot of people come to us because doctors just simply won't grant the request for a test, or more importantly, and probably more commonly, they just don't explain anything to the patient about the test or test results. They just say everything looks normal. And people really want to know what optimal is and where they really want to be. And I find a lot of my patients, they really want to understand the tests and what they can do to actually change their tests.
And may I say something? Can I say something real quick? I just want to insert this too. That, this happened to me many times when I was trying to find out my own thyroid stuff, and I would ask for tests and the doctor would be like, no, you don't need that. And I finally said, why would you think I don't need that? It's my money, it's my blood, it's my time. Why? I'm asking you for something. And it turned out, and one guy finally said to me, all right, I don't even know what that test is for. Okay. And I'm like, oh, okay. Yeah. That makes total sense. So this actually is giving us those things that doctors may or may not even know what they're for. It's going much further than what you would get in a doctor's office.
Yeah, it's interesting you say that. I have a good friend of mine who's who's also an ER doctor. He's probably about 10 years behind me, so he's a little bit younger. And he said, Alan, I have to tell you, be honest about it. I've had people ask me about certain things before, and if I don't know it, I just poo-poo it. And it's really not right. I've really made a mistake doing that.
Mm-hmm.
And I think that does happen, from time to time. Your doctor, if they don't understand it or they don't know it or they hadn't heard about it, they will poo-poo it, or they'll sort of say you don't need that kind of thing. And the reason why they say it is because you don't need that for their treatment, because they don't know anything about it. So they're not going to know. They're not going to know how to. That
makes total sense.
Yeah, they're not going to know how to explain it to you, and furthermore, they're not going to know how to, tell you what maybe the natural things you could be doing to affect those results. So,
right. Yeah.
So, but nowadays, we've got the Google. More people are going online. They're reading. There's more information out there, and there's a lot more resources. And so, people now are demanding, these things to be done, and many of them are now choosing direct access testing. And so this brings us to one of the pros of direct access testing is there's a transparency involved, and people can order what they want and they'll get what they want, all at a cash price, and it tends to be a lower cost than if they go through their higher cost insurance for a lot of people. The cons still are that some states still restrict access, and we have some highly restrictive states that don't allow for any direct access testing, but they are few. So how it works, just so that you guys know, a person goes online, and there's any number of online lab testing platforms that a person can go to. So they go online and they simply order a test, and a lot of people get this impression that health coaches are ordering tests. I mean, we've run advertisements, and people sometimes got upset saying, "Oh, you're having health coaches ordering tests." It's actually the client that actually orders the test for themselves. Now, the health coach may provide information. They may say, "Hey, this is what an A1C is," and they could provide them this information. And if the person wanted to get an A1C test, the person goes online and they order the A1C, knowing that someone told them that it was a 3-month measurement of blood sugar, and maybe it was a good screening test for diabetes. So they go online and they order it. Well, behind the scenes, there's actually, in our company, there's a physician that actually signs the lab requisition so that client can go and get that test done. And then when the test result comes back, that physician is responsible for reviewing the test results for any panic values that would require that person to immediately go to the emergency room. So last year we've done over 1,000 plus tests, and I think we've had to call 2 people, maybe 2 or 3 people, to have them go immediately to the emergency room. And having this protective thing in place for your clients is super key. And so most of the the online lab companies, I hope that they are doing this, because it's protective for people, because every now and then we will identify something where someone needs to go get a blood transfusion, or they need to go do something else that requires their immediate attention. If there is nothing that requires an immediate attention, then the person's lab results are released to them in an online lab report. And we right now are sending people encrypted lab reports, just meaning we protect them with a password so that we're in compliance with the HIPAA laws, which are federal laws that allow for patient privacy. We use Quest Diagnostics for blood draws. There's over 4,000 draw stations throughout the country. So for a client, it has a nearby Quest blood draw station. That's pretty awesome. We've also added a bunch of functional medicine tests in the last week or so. We're actually putting them online, I think later today. But all kinds of things where you can check glyphosate in your own body through an at-home kit. We're just going to collect 10 cc's of your urine. You can also check the glyphosate in your own home water if you want to. Those are just examples, but there'll be many others, including oat testing and so on. So the facts about direct access, that it is available for ages 18 and older, and the reason why they don't check children is really it's a liability issue. We as physicians have to get additional coverage of insurance for 18 for under 18. And so many of the companies just don't do that. And the lab values can be different for children too. And so physicians don't always understand various lab values. And this is why there's pediatricians and there's internists. And the internist doesn't typically treat a pediatric patient. So most of the direct access lab companies are going to be 18 and older. It is available everywhere in the United States except for the restricted states is listed there. And it's a cash-based discounted pricing. So there's no insurance. Now, if a person has an FSA or an HSA, they've had really good luck just getting a receipt and submitting that receipt to their flexible savings account or health savings account. But if you have private insurance, let's say like a Blue Cross Blue Shield or Humana, they require you to see a physician first and get an ICD-10 diagnostic code, which is a diagnosis that will justify that test. Recently, example would be vitamin D for preventative medicine. I just got an email. They're saying that Aetna now is no longer going to be paying for vitamin D testing and preventative medicine. They're now calling it investigational. So even if you do go to your doctor and you're diagnosed with a vitamin D issue or whatever, they want to check vitamin D, your insurance company now is fighting that if you're an Aetna insurance. And many of the insurances will likely follow that. So insurance companies largely dictate on what the doctors can order and at least what it will be paid for. And so that is a point of frustration, a point of pain for doctors. So when I looked into the direct access option for people, I really wondered why would they use this if they were already paying for insurance anyway, because I didn't really understand how lab insurance worked at the time. When I looked into this, though, I found out that consumers are really demanding this option, and I really found out why. So I'm going to tell you, in the bottom of this graph is the year. So in 2010, there was about $15 million done in direct access testing, and now it's projected in 2020 that we'll be approaching $350 million. And so there's been a dramatic rise in people wanting to go out there and order their own tests. Well, in my own personal experience, in about 2013, we had this huge change in the way that I saw my patients in the private practice and their deductibles. The average deductible was about $500 prior to 2013, 2014. And at that time, within just a year or so, I noticed that the deductibles went up to about $5,000 on average for a lot of people. So my estimates to you would be about 70% of my patients experienced this. They went from $500 a year deductible to $5,000 per individual. And so it became very much into their own hands, the costs, for everything. On the lab market, what ended up happening was insurance companies would typically pay for a percentage of the lab tests after you met your deductible. And prior to 2013, 2014, that was about, 80%. And so after 2013, 2014, it dropped to 50% on average. So what does this mean for the lab industry? So what happened is, I know this, I work for the lab industry, I work for lab companies. So what happened is prior to 2013, what we would do is we would send out 3 bills to a person after they met their deductible and then their insurance paid. We'd send out 3 bills for that additional 20% that they still owed the lab company. If they decided not to pay it, we would just write it off because we were just happy with the insurance payments that we got. After 2013, 2014, what's happening to a lot of patients are the lab companies only getting reimbursed 50% instead of 80%. And so they're really hurting, and now they're turning people over to collections. So you'll notice that lab charges can be quite high. And here's this is a real world example from one of my people. At the bottom, you can see the bottom left, there's the ICD-10 code. That's one of the diagnostic codes, and there's others below that. But the idea is that we provide the diagnostic code, hoping the insurance will pay for it. So this is a person who has a big deductible. Say a $5,000 deductible, and their charges are fairly significant for a lot of these tests. If you go to our website and you compare our cost versus the cost here for that person, they would have paid $169 instead of the $641 that they had to pay. And so this is the reason why many consumers now are looking at direct access testing, pure financial reasons, the educated ones. And here's another one here, just another example. The bottom left, the ICD-10 diagnostic codes, and then to the to the left are all the different lab tests that were ordered, and then of course the costs here. And so it was over $1,000 worth of lab tests. But through direct access testing is only $337. So why is it so much cheaper through direct access testing? Well, it turns out that direct access testing, and it took me years and years to get national contracts with Quest, but by getting a national contract, you can literally bring thousands of people into the fray and negotiate prices for everyone. And so that allows it to be a business, because you as a business can make a little money and your clients can save a fairly significant amount of money in these cases. Now, some people have good insurance, so that's the hard thing with insurance is it's not transparent. And so, if you work for, say, Apple or Samsung in Austin, they have really good insurance. Their deductibles are 30%. Their coverage for labs is about a 90% or 100% coverage. And so, these are not the people that would necessarily want to go through a direct access platform. And so I can just give you just rough averages in my practice now. It's about 70% of people would look at a direct access process now because the direct access will save them money. All right. And so I don't know if we're getting some questions there. It looks like there might be some questions coming on. So I'm happy to.
I usually like to wait until the end so you can keep going.
Okay.
And
okay, sure.
We'll hit them. Yeah.
Okay, sure. All right. All right, well, I'll keep going here. So your role as a health coach, I think, is pretty awesome right now because you can advocate for your clients. And advocating is just understanding, what's going on in the marketplace and being able to, point them in the right direction or at least give them the resources. I think it's important for health coaches to be transparent, particularly when it comes to recommending things. And then, of course, education is really awesome. Education is the great opportunity that we have. We as doctors just simply don't have time in our short visits with people to sit down and really spend time connecting and really educating and finding where the person's pain points are and how best to help them. Unfortunately, allopathic medicine has turned more into, what is your disease and here's a prescription for your disease and, hopefully it works out. So it's just not really working out for chronic disease. Okay, so what I would encourage people to try to do is if they want to add some passive revenue to their health coaching business is simply become an affiliate. Now you can become an affiliate with us or you can become an affiliate with other direct access lab companies. We tend to pay more to our affiliates more than everybody else, and we pay about twice as much. Most lab companies will pay commissions on sales. We screen affiliates, and it doesn't cost anything to become an affiliate. You can just go to the bottom of our homepage and click on Become an Affiliate. There is a LabIQ private Facebook group that we do have. We have approaching 6,000 health coaches on there right now and integrative doctors. We try to bring in integrative doctors to talk about lab tests so that we get a different spin, right? And we have had allopathic doctors on there. I had a cardiologist on there. He's not an integrative cardiologist, but he's an allopathic one. He talks about how he looks at the advanced cholesterol panel. We just recently had an oncologist on there. She's an integrative naturopathic oncologist, and so she helps people after they recover from cancer or as they're going through their cancer journey with all the natural things that they can be doing. So kind of an interesting group of people, a little bit different than what you'll see in a traditional medical setting. And it really is meant as an interface between health coaches and integrative providers so that we can better understand and relate to each other and understand how we can best help each other and partner together. So an affiliate really is about a partnership and really adding to your value and into your own health journey. That's how we view it. Now, we're a little bit different because if you do use your affiliate link when you order your own labs, you will actually get an affiliate payment for that. Most of the other lab companies don't allow this. So let's say you wanted to order your own TSH, then you would just order it through your affiliate link. And once you type that link into your browser at the very top of Chrome or Internet Explorer or whatever, our cookies on our site will track your progress through our pages, whatever page you land on, and go back to. And then even if you leave the page, and let's say you go and visit another page, and then you come back eventually within 24 hours, you'll still get that affiliate credit. So our affiliate software tracks your progress through your browser for 24 hours. So if you order within 24 hours through your affiliate link, you get credit. And if your clients order through your affiliate link within 24 hours, you'll get credit. So that's kind of how it works on the back end on the software side of it. So here's a great example, and this is the first health coach that I found online. I just sort of Googled who was a partner of ours, and I just was curious to see how she was doing it. And Carmen, she was one of yours, and she was doing it all the right way. It was awesome. Yep. So I just wanted to show you guys how she did it. Number one, she followed the things that I love to see. She was advocating for her clients. She was transparent, and she was educating. And so I just wanted to read to you just briefly. It's such an amazing tool to have in our health and wellness toolbox. I'm so thankful to have this resource for myself and to be able to share it with you. So, right, it's a resource for her because she can actually order through her affiliate link and save even more money than just ordering herself. So that's nice. But she offers it to her clients. Hey, if you'd like to order your own labs, please use my affiliate link. And she has a hyperlink to her affiliate link behind that green wording there. And then she's transparent. She says, using the link costs you nothing, because it doesn't. It doesn't cost your client anything extra. You'll receive labs at 50 to 80% less than you'll pay elsewhere. And the reason why that most direct access lab companies will put that is because of that explanation of benefits examples that I showed you. I mean, those people are saving a significant amount of money when they go through direct access testing. And then she says you'll receive your results in a safe, confidential, and convenient way. And by the way, a small percentage of your purchase goes to support my work here. So that's total transparency there. And really, if anybody recommends anything online as an online advocate and they're getting money for recommendations, they should put a statement in there of transparency. And this is not my rules. This comes from the Federal Trade Commission. They really want to see that people are being upfront and transparent about what they're recommending. Yeah. And then for her, I think this is really, really important for health coaches. Please note, I'm not a medical doctor and I cannot receive lab results from the lab, read or interpret labs, or diagnose or treat any medical condition. This here is meant to protect you guys, the health coaches, and to set proper boundaries around your clients, because clients don't know. They don't have any idea. They assume that since you told them about it, maybe you're going to get the lab results and you're going to tell them, you know, what the lab results mean, and you're going to diagnose and treat whatever medical condition there is. So I think it's good for people to have this boundary, and it doesn't mean that you're not super valuable. Look what you can do. So below, she talks about that. What I can do is share with you Dr. Allen's optimal functional ranges for labs, guide you to resources to help you understand your labs, and so on. And I think this is really kind of cool, is that she can actually really help people and develop questions for them. What she does is she sits down with her clients over an hour and she reviews the labs to answer questions for those providers, to come up with questions for the providers based on the resources that she has. So really it's about connecting with your client, holding their hand through the process, and hopefully giving them a really good financial option for them. Because again, many people will want this financial option when they understand it. And if you don't believe me, you just have to look at the total amount of people that are ordering direct access testing, just increasing dramatically.
Yeah, I want to say one thing, if you don't mind. Sorry, interrupting. That was one of my students, and I want to say this too. It is actually illegal to make money without telling people you're making money that way, as you mentioned. I just want to put an exclamation point on that, you guys. If you are an affiliate and you are promoting something, you have to say that you're an affiliate, or you have to say that you make money in some form or fashion. Legally, or you can get in trouble. The other thing I want to say is at the bottom of her form here, she says she offers a la carte options. This is actually something I added to the curriculum. It's a great opportunity to even add on something. I call them a la carte options, because if they order lab tests, maybe they only want an hour consultation to go over important things. So an a la carte option is a fantastic way to add revenue to your services. So I just want to make a plug there that Christy's doing everything exactly as she should. This is great. Fantastic.
Yeah, I think she's doing it right too. And it's nice for her, right? Because as a business, you want to be able to offer your clients some resources. And so I do think it's good to find a partnership with a nutraceutical company, a partnership with a lab company, a partnership, partnerships are going to be good for you guys as you build your business. And we hope, by the way, as a lab company, to help bring partnerships to you. We're a young company, and we constantly have people coming to us wanting to partner with us and really offer our people, which is you health coaches, the opportunity to benefit financially from being a distribution point. But for us, we have to bring you good things, right? Things that really make sense. And so that's all something in the background that we're continually working on. All right, so I would encourage everyone to go ahead and apply to become an affiliate if you haven't already. You can just click on the bottom there, become an affiliate, and that's all you need to do. And then just put, that Carmen referred you, so that we know you're from the IFHC group. If you wanted to have blood work done on yourself or your clients, I think one of the things that I want to point out, because it is important to understand that this is not available everywhere. And so some people will get really upset because they get really jazzed about the idea of doing this, and then they realize they don't have a blood draw station near them. Now, with our rollout of a lot of the functional tests, that issue is going to become a little bit less because people will be able to have a lot of kits shipped directly to their home. We're partnering with Great Plains Labs and multiple other labs. There's 3 other labs, and all these kits will be urine collection kits for a lot of these tests, and blood spot collection kits. So they will be able to be done at home. So that's kind of nice. But blood testing is super important, and I love blood tests, and my 5 pillars of aging are mainly based on blood tests and evaluation of those tests. And I'm going to show you a couple of case examples of why they're so important. So it is important for you to identify for yourself and your clients, is there a Quest Draw station nearby that they could potentially use? Quest Draw stations do open and close, and so they will come and go. That is something that people just need to know about. If you're curious about where one is, on our homepage, you can click on the Locate a Draw Station near me. Currently, we use Quest, Precision Analytical, Meridian Labs. We're partnering with Genova Diagnostics and also Great Plains Laboratory to offer not only thousands of blood draw locations, but also these additional test kits for people. One of the most common things that people like once they get to know us is to be able to go order a custom panel. And the reason why they like this is we've put all of our tests we run on one page so that people can easily access test descriptions and be able to order a single test at a time. And you'll notice on the bottom of this page here, there's a calculator. And so this is great if people have a budget. So if they want to spend $100 on lab tests or $200 on lab tests and stay within their budget, they'll be able to pick and choose which tests that they can run for that particular budget. People tend to love this, particularly for follow-up testing. A lot of my patients will get complete blood work done, and then they will follow up with individual tests, because obviously if they get complete blood work done, there's a lot of things that look great, and we don't need to retest those. It's those things that don't look good, that aren't optimal, things that we need to work on. Those are the things that need to be fixed or watched over time. And again, to the left is the ability to just click on a tab, and then what will pop down from the tab will be all the tests that are available underneath that tablet. So for example, sugar metabolism and diabetes screening, you could check a glucose or an insulin or an A1C, or maybe you can bundle all those above and you'll save more money. Or if people are really in the know, and this is what functional medicine is doing right now, is a 2-hour glucose tolerance test with insulin. This is for people that may have prediabetes to check and make sure they actually don't have diabetes. And we can actually tell from a functional medicine standpoint whether a person has a 1% risk of going on to develop diabetes or an 80% chance based on the glucose tolerance test. So I do like to look at a glucose tolerance test for all my pre-diabetics. So because I do that, and it's because I try to roll out everything I do in my practice, I put it on here. Now, we don't get a lot of orders for this because people don't understand it. But people do understand the glucose and the insulin and the A1C. And then to the right are the test descriptions. Maybe you had somebody that didn't really understand what an A1C is. And so if we go to an A1C, you'll see the test indicates how well controlled your sugar levels have been over the past 3 months and can indicate a pre-diabetic or diabetic condition. And so it's a very stable measurement of your blood sugars. So people tend to like that. Our popular panels are also put out there too for people that just want to know what panels most people are looking at. Our advanced cholesterol panel is really popular, and I'm going to talk to you about why I think each one of you should have one. Nutrients and omegas are also pretty popular. Many people are deficient in a lot of their nutrients, and about 90% of people are deficient in omega-3s. And then finally, our transformation panel is like our whole enchilada. It takes into account a lot of the blood testing that I do in my 5 pillars of health. And this is what my clients get when they first come and see me, is they get that full comprehensive look so that we can focus in on those areas that they need to improve on. And again, it's $1,750, but if you look at the amount of tests that are in there and the relative cost for their insurance, it's literally thousands and thousands of dollars more for a lot of my clients if they go through their insurance. So it may look expensive there, but it's three times more expensive for many of them when they go through their insurance. So the transformation in panel is pretty comprehensive, and this is what it includes. If we start up to the right, this is the inflammation biomarker category. We like to look at the CRP because we know if it's less than 1, it's optimal. If it's above 2, there's an increased risk for stroke and heart attack. As it goes higher, above 20, we have to worry about autoimmune disease and cancers. And so it's a great screening test. CRP should be done when you're feeling great. It's your baseline health, not when you're feeling terrible, you've had a recent surgery or illness, because your CRP is an inflammatory marker. It will increase when you're feeling terrible. So we really like to see CRP levels Lesson 1, if your CRP level is high, we do recommend you get it rechecked in a period of 6 to 8 weeks to see if it's persistently high. If it is, you have chronic inflammation. There almost always is a reason for it. And so fixing that chronic inflammation becomes pretty important. Homocysteine, I was just talking to my dad about homocysteine because on his blood work, it came back elevated. His father had Alzheimer's, and he's at risk for Alzheimer's because his homocysteine is high. There's a super strong correlation between homocysteine and not only Alzheimer's, but all forms of cognitive decline. And so the treatment is super easy. It's actually, we use B vitamins to lower homocysteine. And so now I have him on a very natural solution to bring down his homocysteine. We were just talking about how he needs to get it rechecked to make sure that the natural treatment is actually working. And then homocysteine, by the way, when it is elevated, it's also an independent risk factor for early stroke and heart attack. And so again, it indicates a problem with the methylation pathway. And Carmen, you and I did something on the MTHFR where we kind of did a deep dive into the methylation pathway, really important for the aging process. And so we like to measure biomarkers, again, that give us an idea of how well you're aging. If your homocysteine is high, you're not aging well. And uric acid, this is another thing that I love to look at with inflammation because the treatment, again, is very natural. And if a client has the right resources, all they need to do is simply institute a dietary change to lower the amount of purines in their diet, and they'll stop making so much uric acid. If they don't, then what's going to end up happening is they're going to start to precipitate the uric acid in their joints, and they're going to develop gout. And then they're going to come into the ER and see me and try to get me to cut off their toe. Everybody always wants to get their toe cut off. I don't know why.
But it's painful. I've heard it's awful.
Yeah, it is super awful. And it occurs really at the base of the great toe, but also the knee and the elbow and so on. And there are some very natural things that can be done for people that are at risk. And how do you know you're at risk? Well, you get checked before you have symptoms and you actually lower your risk. You don't have to go through that. And of course, thyroid peroxidase antibodies, super important for men and women, particularly because they're much more likely to get autoimmune thyroid disease. And the thyroid is one of the most commonly affected organs when it comes to autoimmune thyroid disease. And if we see it coming 5 years ahead of time, which is very common, we can see these antibodies start to elevate. There are some very natural things that we can try to do to reverse the inflammatory process in the body. And then ferritin, really important for women in particular. Lots of heavy periods over a long period of time can lead to iron depletion. And ferritin is really a transport protein, and it's also what we call an acute phase reactant. It means that it reacts to inflammation. When it's super low, like less than 41, we oftentimes will just go ahead and replace women with irons. We'll just put them on iron replacement. My grandma had the exact opposite problem, a genetic issue where she just stored too much iron, and her ferritin levels were in the thousands. And if a person has a ferritin above 500, they need to check their iron, and very likely will be super high. And if it is, guess what they do? They just go donate blood. And what I tell people is that there's two ways to donate blood. One, you can donate it because you really just want to go donate it and you want them to pay you $50 for donating it. Or you can actually tell them, hey, I have hemochromatosis and I need to have my blood taken, and then they're going to run it through your insurance. They're going to charge you $50, and then you're going to donate your blood anyway. So I do like to test for ferritin because it's a great way to pick up a hemochromatosis or very high levels of ferritin. If you do pick that up, you can actually really save someone from an early death because they will develop this problem with their liver. Their iron will deposit in the liver and the heart and the pancreas and then cause all sorts of problems from liver damage to heart damage to actually the destruction of the pancreas. So it's really a nice biomarker to know about in preventative care. Now, if we move down to the right in insulin dynamics, again, we're talking about everything in the transformation panel. We're not going to just look at your glucose and A1C. We want to measure the things that we think are very helpful, which are fasting insulin. Fasting insulin is made from the pancreas. The insulin is made from the pancreas. And when it goes high, that's the first thing we see on the road to diabetes. And so wouldn't it be nice to know if you're at risk? Well, if you have a really high insulin level, you are. And by the way, it's really hard to lose weight if you have high insulin because insulin is a fat fertilizer and it really encourages you to hang on to fat. And then we like to look at vitamin D. Why? Because we think it helps with insulin sensitivity. Vitamin D does lots of things. I mean, there's a lot of good data around cancer prevention, but insulin, we think that it makes insulin work a lot better. I love to check vitamin D. I'm really disappointed at this decision not to pay for it because if I can get people high enough on vitamin D, they have less problems with depression. They have less problems with their blood pressure. If they have bipolar or some neuropsychiatric illness, they tend to have less breakthrough issues with that. So it's really something important for a lot of good reasons. And again, it's a very natural thing that we can replace, and not very expensive. The problem is the blood test is pretty expensive, and this is why the insurance companies have found a way to try to stop paying for it. And then hormone imbalances. I do like to look at estrogen, progesterone in the bloodstream, and cortisol. Cortisol is really important. It's a stress hormone. If it's super low in the morning, that's a major indicator there's a sleeping problem. Most often it's obstructive sleep apnea for many of my patients, but I do like to check it for people. It should be super high in the morning, like 20 to 25, and then really low at night. It's a get up and go hormone. It means it needs to rest at some point. But for many people, it's surging all night long. And when it surges insulin. And so instead of fat burning, like they're supposed to do in the deep stages of sleep, they're putting on weight and they're going into fat storage mode. So again, for weight loss, really, really important biomarker to look at. Thyroid, we're not going to just look at a TSH. We want to look at the free T3, which is the active hormone of thyroid. And then we also want to look at releasing hormones from the brain that have to deal with our sex hormones. And then we want to look at our sex hormone binding globulin and albumin, because what they do is they actually transport our sex hormones. And so for understanding how the sex hormone pathway is working, I like to look at all of those. And then nutrition, of course, we like to look at B vitamins, important in the methylation pathway. Omega-3s, we want to look at the ratio and the index of omega-3s. About 90% of people are, again, deficient in omega-3s. We want to measure zinc and selenium. Zinc, not only because it's so great in helping prevent illness, but it also helps convert into active thyroid hormone. So it converts T4 into T3 along with selenium. So these are things that can be measured in the bloodstream, and we love to include them as far as in the transformation panel. We also want to measure magnesium. About 80% of people are deficient in magnesium, so we'll measure red blood cell magnesium, and then a complete blood count. We want to make sure that the bone marrow is working okay, and it's an essential test along with a comprehensive metabolic panel. Essential test that everyone should have once a year, irregardless. It's that critical. And then finally, the vascular integrity, aging well. We like to look at a advanced lipid panel instead of just a fasting lipid panel. And I just want to show you why here in a minute. Our common tests are not commonly tested. So we're going to talk about things that maybe allopathic doctors really just don't think about too much. Because they've been trained a certain way. So this is a thyroid gland. Looks like a little H or a butterfly here in the middle of the neck. And Lisa was thought to have hypothyroidism. So this is, Mona Lisa. I believe she was around in the 1540s. She lived in Italy, a little town where they thought maybe didn't have much iodine in the soil. And so back then, iodine deficiency was the #1 cause of hypothyroidism. And people who have hypothyroidism oftentimes have symptoms and physical findings that we can see as doctors. And people can notice these things and not really realize that, hey, there's something wrong with her, but I'm not quite sure what it is. So let's talk about this painting here. So two doctors, and this is not me, this is two doctors wrote an article in the Mayo Proceedings talking about how they think Mona Lisa had hypothyroidism. She was missing the lateral third of her eyebrows. She had a weak smile. Her hair is thin at the top, and she's kind of coarse as it goes down her neck. It felt like the anterior neck was quite full, like she may have a goiter. And then her hands were kind of edematous there, kind of swollen. All the physical findings of hypothyroidism. But, the most common thing that people have when they have hypothyroidism is they just don't feel well. They may have mood changes. They may have depression. They may have weight gain. They may have cold intolerance. They may have problems with their hair falling out, their nails getting thin. So all of these things are symptoms that people can, of course, go online now and read about. So here is the power of direct access testing in action. So we had a patient come through. It was a client of ours, since we don't actually do medical care. So this person went to their doctor and said, hey, I have these symptoms of thyroid problems. I want to get the full thyroid thing. And they said, all you need is a TSH. So they checked her TSH, and it was 4, which was within the normal range. Well, she had been doing some reading. She did some research on her own. She decided to get her own thyroid test through our website, but decided that she would get tests that she had read about and learned about, and she did. And so therefore, she actually ended up doing a really good job for herself, because she, unbeknownst to her, she gave herself a diagnosis. And so she knew by reading that she had an autoimmune thyroid disease. The number one cause of thyroid disease in the US is Hashimoto's thyroid disease, and it affects over 20 million people, again, mainly women, in a 10-to-1 ratio. And so in 1912, there was a 31-year-old doctor, very, very young guy, Japanese guy, who discovered this lymphocytic infiltration of the thyroid gland that occurred in lots of women's thyroid glands. And so about 10 years later, they wrote a paper and coined the term Hashimoto's thyroiditis. And it really refers to the body attacking the thyroid gland. And so we'll see the antibodies elevate in these people 3 to 5 years before we see any changes with the TSH or the free T3. And so nowadays, she's having symptoms now, right? So she's having symptoms. She's got further testing done. She went to another doctor and actually got put on a treatment so that she could actually reverse her symptoms and stop her hair from falling out and lose some weight and feel better. And so that's the power of direct access testing now, is that people now are they're empowered to take information into their own hands and, dig a little bit deeper than their primary care doctor may want to or may have time to do. To go over my optimal thyroid numbers for you, my optimal TSH is actually nowhere near 4. It's actually 0.4 to 2.0. So I like to see it there. Again, when we look at reference ranges, they include all the people in the population that feel good and all the people that don't feel so good, right? And so reference ranges are just simply reference ranges. When we're talking optimal, we'll find that 90% of people really should be less than 2. So 0.4 to 2.0. Free T4, I like to see that above 1, and the free T3, I like to see that above at least 3. And then the peroxidase antibodies, I like to see those quiet or completely normal. Peroxidase antibodies will elevate about 85% of the time or so. Thyroglobulin antibodies will elevate about 60% of the time. So we do like to check both just to make sure we're not missing an autoimmune thyroid disease, because we can still have an autoimmune thyroid disease even though the antibodies are negative, because the antibodies can go up and go down. And if we miss it, then we're going to miss the diagnosis. But in her case, she actually had enough information that she went back to a doctor and actually was given treatment for this, and she felt a lot better. The standard lipid panel is another thing that is commonly done and covered by insurance, but it's very basic, and it includes the cholesterol and triglycerides, and I'm sure most people have had this. The LDL, which is the lousy cholesterol, is simply calculated. It's not directly measured, so that's one of the weaknesses. Now, as an ER doctor, I became really interested in this when it came to preventative medicine, because about 90% of the heart attacks that I see, people's cholesterol numbers look pretty decent. And so really what's going on? Is there something deeper? Well, as it turns out, there's something much deeper than this, and it includes not only inflammation and sugar problems, but it also includes a genetic problem. And we didn't really have an appreciation for this until fairly recently. So this is a guy from NBC's Biggest Loser. His name's Bob Harper. He had a heart attack at age 51. He looks like he shouldn't be having any heart attacks. But he revealed to Dr. Oz that the cause of his heart attack was due to a condition called lipoprotein A. And so a lot of us began to, and this, by the way, this is an article that was posted by Sandra Tremulous. Sandra founded the Lipoprotein A Foundation. And the reason why she did that is because she actually had lipoprotein A and she had an early event. Early heart problem, and she looked into this, and she found out that the testing simply wasn't being done, and it wasn't being covered by insurance. And furthermore, there was never there hadn't yet been a diagnostic code yet, so even a doctor couldn't even diagnose a person as having elevated Lp(a). So the insurance companies refused to pay for this test, and I've gotten really upset about it and talked to them, and they say, oh, you just need to start a person on a statin. Well, statins aren't for everyone, and when you go on a statin, you really have to think through why you're going to go on it, and really, that's really not the right approach. So the absence of the information didn't indicate that I should be doing something differently. What I needed was the actual information. So I looked into it, and I found out that lipoprotein A is very common. And there's about 1.43 billion people that have it in the United States. If you hail from Africa, your chance of having it is about 30%. Remember, it's genetically inherited. If you hail from Asia, your risk is the lowest at about 10%. Here in North America, our risk is 20%. So that's a huge number of people. So that'll be 1 in 5 people that we encounter will have elevated lipoprotein A. So really, what is it? It's a modified LDL cholesterol molecule. So it's a smaller cholesterol molecule that tends to cause heart disease, right? But now it's being modified that now it has this little sticky portion on it that leads to increased risk for stroke and heart attack, and blood clots too, including DVT and pulmonary embolus. And so I started looking for this in my own family, and I found it, unfortunately, in my wife. And so now I know that each one of my kids has a 50% chance of getting it. We also checked her parents, and neither one of her, or both of her parents actually had lipoprotein A. We had to do some additional testing because when you see elevated levels of lipoprotein A in some people, well, in most of my people, I'll send them to a cardiologist to get screened. And we sent her father for a coronary calcium score. A normal coronary calcium score, by the way, is 0 to 400. His measurement was over 2,000. So you can see that he's super, super high risk. Now, he had no symptoms, so they sent him for a stress test just to make sure he wasn't having problems with his heart. So the idea here is that we don't know about it right now. Nobody's getting checked. Insurance isn't covering it. Many doctors aren't being trained and understand it. And so there's a big push right now in preventive medicine that we understand this risk factor. We would always look at people from Asia and say, what are they doing over there? They tend to have less stroke and heart attack. Well, it turns out they have half as much of lipoprotein A as us, which can be significant when we're talking about 20% of the population. By the way, one of the nurses in my clinic ended up having this, and her mother had a heart attack at age 47, which is why I encouraged her to get tested. And we found a lesion on my nurse's artery, in her left anterior descending artery, at the exact same location that her mother had a stent put in years earlier. And it was in the widowmaker artery. So again, these are things that if we know about it in preventative care and talk about it, and these are great things for health coaches to talk about. They're great to talk about lipoprotein A and to learn about it, and and to encourage people to get tested for it, because you really can save somebody's life, and that's so awesome to be able to do that. This is what it looks like. The Advanced Cholesterol Panel gives you far more information than a standard panel does. At the very bottom, this was actually a physician that came through our site and called me after his blood work because he was really concerned about his lipoprotein A. This is one of the highest lipoprotein A levels I've seen at 325. So the way that we look at an advanced cholesterol panel is we're looking at both good and bad cholesterol, right? Because there has to be a balance. We want to have a lot of HDL or good cholesterol. And what we never know is what type of HDL a person has. We want them to have HDL large, and we want them to have a large amount of HDL large. So that's on one end. On the other end, we want to see what type of bad cholesterol they have. So LDL cholesterol, lousy cholesterol, there's really sort of two ways we form it. We either form it as sort of a light, fluffy kind that doesn't really cause disease, or small and dense LDL cholesterol that tends to cause disease. So the first thing I look at is lipoprotein A. Do you have lipoprotein A? Yes, you do. Then I want to know what type of LDL or lousy cholesterol do you have? Do you have a lot of the small cholesterol? Well, it turns out, yes, he did. He had an enormous amount of small cholesterol. Then I want to know, okay, so we've got all these bad cholesterol particles. What is his ability to get rid of them from the lining of the arteries? So then I want to know, does he have a lot of HDL large or happy cholesterol? Does this happy cholesterol, is there enough? And so it turns out he has an enormous amount of lipoprotein A, he has a lot of LDL small, and he has very little HDL large. So he's completely out of balance, and he's got the most destructive cholesterol. He's at super high risk. And so we have to reverse all the other risk factors that he has, and then we have to get him to a cardiologist right away. He, in my estimation, needs a coronary calcium score, plus or minus a stress test, depending on what we see with this. So again, this is an idea of before we'd have just looked at his cholesterol panel and said, well, it doesn't look good. But we don't need to worry about it too much. And all of us are into dietary intervention. I mean, I love dietary intervention, right? Because we can change cholesterol numbers by about 30%. The most I've ever seen anybody change is about 35%. That's pretty good. Statins can decrease your LDL cholesterol by up to 60%. So for some people, it's the right thing to do. HDL cholesterol goes up for a variety of reasons. And then what do we do about lipoprotein A? So I'm going to tell you exactly what to do about lipoprotein A in a minute. So the point here is that we want to, in medical school, I teach all the residents to see one, do one, teach one. So the first thing you do is you kind of see the process, and then you do it on yourself, and then you teach somebody else how to do it. So my ask for you guys is, become an affiliate. It doesn't, cost you anything to become an affiliate. Get your blood drawn, test the system. If you want to order a blood test through us, we'll give you a special discount code called Webinar20. And you can just plug that in at checkout as a coupon code. That'll give you $20 off your test. And then, of course, if you're an affiliate, you'll get your affiliate share as well. If you want to, you can do this deep dive education on the 5 pillars of health. This is something I offered really out of demand of people once they understood the way that we look at aging and how we can actually measure it very individually. So I'm going to give you guys a special offer for the Transformational Panel Labs. So you can get all those labs that we talked about, and then plus some really cool resources for your business. Because the idea would be that if you really get into becoming an affiliate, you're going to make money, and you're going to actually be able to pay yourself back for all these labs. So this includes 60 plus blood tests, and we say this because it includes all the testing involved in the complete blood count and the comprehensive metabolic panel and all those other tests that we talked about. Our current price on this is $1,750, but not for you guys. These are the tests it includes, and I'm not going to belabor this too much because you've already seen this on the other slide, but the idea is we're going to go into all 5 pillars of education for aging, and we're going to actually look at these as we go through the education process on each and every one of these labs. So when people looked at this, they kind of thought, man, wouldn't it be great if I was sitting down with my client and I had the ability to see the biomarker and what that biomarker was checking, and then what the optimal level was, not just the reference range, and then what the natural treatment recommendations were that they could discuss with their doctor. Wouldn't that be great? And so I thought, well, man, that sounds like a great idea. So I created these what they call cheat sheets here. And I actually give these out as part of this education process. So here's an example. So the biomarker up here is MTHFR. It's a genetic test. The description is it evaluates for 2 common gene mutations, 677 and 1298. So we do a whole hour lecture on this, Carmen, right? Yep. But we really want to okay, so you listen to the lecture, now you want to put it in practice. Somebody has an MTHFR result in front of you. What do you need to worry about? What can you counsel them? How can you point them in the right direction? Well, all you got to do is pull this thing out, and you'll know, hey, if positive with either mutation, they probably should consider a baseline homocysteine, because remember, homocysteine is that marker that determines whether or not their methylation pathway is actually working. You can have a gene mutation and your pathway can still be working. You'll be able to know whether or not because you'll measure homocysteine. Mm-hmm. You also want to probably get a B12 and folate level just to see, because the treatment for elevated homocysteine is methylated folate, methylated B12. And so these are the doses. And so I'll put the doses in there. You need to know which gene mutation is most problematic, the one that's most likely going to cause their problem. It affects 10% of the population. So that's quite a bit of people, right? 1 in 10 people. They have reduced methyl tetrahydrofolate reductase enzyme activity by 65%. And so this means they have a low serum folate regardless of their dietary intake, and they almost always have elevated homocysteine, and this can lead to global DNA methylation problems too. So again, this is a person, just imagine if you have a global DNA methylation problem, sounds like cognitive decline to me. I mean, you're going to have big time risk for cognitive decline. And they've looked at people's cognitive efforts with these high homocysteine levels around the age of 50, 55, and they found that they literally are about 3 to 5 years behind their peers with normal homocysteine. So there is a super strong association between the methylation pathway and the way that our brain ages. So there's that problem. And then the second problem on this is the increased risk for stroke and heart attack. So our body doesn't seem to like it either. So this is like the take-home stuff. Again, ApoE, this is another good thing. I actually happen to have ApoE3/4. So what is it? It's a test that determines the subtypes of ApoE3, which will aid in the assessment of coronary artery disease and risk for early cognitive decline. So again, the first 2 things have to do with cognitive decline and heart disease. So everyone is okay unless they have ApoE3/4 or an ApoE4/4. So on Lab IQ, I have a doctor who has ApoE44, and he talks about his risk. His risk is 50 to 90% of developing Alzheimer's. That's pretty high. And he talks about all the things that he does to try to lower his risk. So wouldn't people like to know about that? It's kind of interesting. I have ApoE34, so my risk is still significant. It's about a 30% risk of developing Alzheimer's, which wouldn't, that's not uncommon considering I have a history of Alzheimer's in my family. Again, this is a genetic thing. So if you have concerns in your family, I strongly encourage to get checked, because there are some approaches that we can do that are quite natural in trying to lower our risk of developing early cognitive decline. And then finally, lipoprotein A, and I think I talk about this on the next slide. Lipoprotein A is the worst type of LDL cholesterol. Again, it's genetically inherited. 20% of the population has it here in North America, and you get a high risk for blood clots. So if you're a young woman, maybe you're in your 20s or 30s, and you're considering birth control pills, and you know the birth control pills carry a risk of blood clots, and you knew that you had lipoprotein A, you may want to reconsider using oral birth control pills because of the risk for blood clots. Now, if you never knew that you had lipoprotein A, you would never even think to talk to your doctor about it. But since you got tested and now it's one of those things to think about, because the birth control pills can increase your risk for blood clots. And by the way, so does smoking, and so does having lipoprotein A. So why do you want to smoke when you have lipoprotein A? Again, we're looking for that lever point or that pain point with our clients to try to get them to a certain behavior that's going to help them. So again, this is really valuable information. So my recommendations for this are omega-3 fish oil can reduce by 10% niacin if we do high dose slow release niacin. It's the flushing kind. It can reduce it by the most, 30%. Most people will be on a baby aspirin to prevent blood clotting. And then we want to get that LDL cholesterol to as low as possible. You just need to know that nutrition and statins will not lower lipoprotein A, but they will lower the LDL cholesterol by up to 30-35%. Most people, I encourage them to follow up with a cardiologist for a coronary calcium score and an overall risk evaluation. And many women need to know that it's going to go higher after menopause. After you lose the protective effect of estrogen, the lipoprotein A will go higher. And then I do recommend adult family members be tested so that we can talk about their overall health plan, as they age, because they're just at higher risk. These are the people that are they're triathletes. These people running marathons that just drop dead. These are the people in your family that you're just surprised because you didn't seem to have any other medical problem. These are the people like Bob Harper that look like, they're in great shape and then just drop dead. So the idea here is to understand the risk very early and to then watch people very closely. And not to discourage people, but niacin doesn't really work that well for most people because in my patient population, 70% of people do not tolerate niacin because of the flushing. And so the non-flushing doesn't work. So many of them try it and they get discouraged and so on. Well, they're now coming out in phase 2 clinical trials for medication to lower lipoprotein A by 90%, 90%. So for some people that may be necessary, particularly if they're like my father-in-law who's got advanced coronary artery disease. We were doing everything possible to get him reversed, because you can reverse that disease. It takes time, but it can be done. And the earlier...
Yeah, go ahead. But I'm going to ask you something when you're done. Go ahead.
I'm just saying the earlier that you do it, the better, right? And so the idea here is that we want to provide really great resources, information for our clients about what these tests are and what they're meant to do. And then most importantly, we try to encourage our health coaches who go through this course to actually take these and laminate them. And then when they sit down with their clients, just circle the things that they need to go talk to their doctor about and make it really easy for them to learn about those things. And again, people don't have problems in every area. People are going to have problems only in certain key areas that need to be pointed out. And by giving them this stuff, if their doctor doesn't know it, it'd be great for their doctor to know it. Because again, this is all evidence-based research. So if the doctor doesn't know it, maybe they'll go and they'll read about it. The course that we offer as part of this is a course where we go over each one of the tests in the 5 pillars of aging. So we go over all the blood tests in the transformation panel that you would get. And the idea was that initially we were just going to have a course for people to take, but then I kind of thought people are going to learn a lot better if they're actually looking at their own blood work and going through the course. Or we allow people to gift that blood work to a friend or a loved one, spouse or otherwise, so that they can actually be really attached to that blood work and how to fix it naturally. And so the idea was that a person gets their blood work done, and then they sit down and they go through and they read about, hey, what does this blood work, actually mean? And this is a continuous access resource that I update all the time. We recently added Dutch hormone testing, for example. It's a urine test kit from Precision Analytical. It's one of the newer tests. Precision Analytical, I think, was founded in 2006. So what we did is we put it online here where I explain it, because Dutch is very complicated. So I'll go online, you can explain it. So as we go through the years, we sort of add on different information and content about the testing. Again, thyroid testing, we talk a lot about that. Reverse T3, we talk about that. Adrenals, we talk about that. And then we have downloaded resources where people can come and they can actually download things that we actually use in our own anti-aging clinic for people to consider when they're talking to people and educating them about thyroid. Thyroid is very complicated, right? And you shouldn't be sitting around trying to figure out your client's overall thyroid issues, right? Because it's extremely complicated. But what you can help them understand is it's complicated, and it's really important to work with a doctor that understands how complicated it is, and then to point them to the right resource. And by the way, we have physicians that take this class, chiropractors, nutritionists, and so on. So it's not just for health coaches. I actually have just patients, health optimizers that just love to have good health information. So at the end of each one of the pillars of health education, we have a webinar that we do. It's actually not live, it's a recorded webinar where we actually talk through each one of the biomarkers, and I talk about how I fix each one naturally, so that people will understand there's natural treatments for many of these things. And most allopathic doctors will not know the natural treatments because they simply aren't educated on it. They don't put a lot of time into the natural things. We're just not, think about it. I got an hour's worth of nutrition in medical school, so I would assume most doctors got about the same. For people who are health coaches, we decided to throw in this offer to build them a custom landing page. And the idea here was if you affiliate with us, and again, we made this decision early on that we want to support the work of health coaches because we really feel like your work is valuable. You are the people that can connect and provide resources and advocate for your clients. And so in a time when their clients are spending more money on their own health care, when they're stuck paying the bills, they need to know about this potential resource, not only to save them money, but also to get them some really great tests that's really going to help them. So wouldn't it be great if we could somehow associate you with us in a way that makes that client feel really good about our relationship? So we built these custom landing pages for people as part of this offer. JJ Virgin is one of our online affiliates. So is Kellyanne Petrucci. I contributed to her recent book. And so they were like, hey, this is such a great thing. I want to be able to offer this to my online followers. So instead of just clicking on just a generic affiliate link and coming to your homepage, I want them to actually come to your custom lab order page with my name and my bio on there, so my followers know I'm in the right place. So we thought, wow, this would be really cool for health coaches to do as well. And so this is part of what we're offering you. So this is an example of a health coach. Again, she set her photo. No bio for her. You don't have to do a bio if you don't want to, with just an explanation about how the testing works and so on. And then if you do complete our entire education process, which takes really 10 to 15 hours if you really wanted to go through it all at once, I try to encourage people to get their blood work done, use the cheat sheets as they're going through their blood work, and then focus their learning on those areas that they need to fix for themselves in a natural way. When they feel really comfortable about that, then they start to actually look at labs and then look at natural solutions using the cheat sheets, and go back and use the training modules as a reference, because it's a deep dive reference tool for everyone. If you do go through all the 5 pillars of health training and you want to get a certification, you can. It's called ABT certification. It's for advanced biomarker training. It just certifies that you completed all the work and you actually passed the test. There's an 85-question test right now that you have to pass. You have 3 chances to pass it, and it's just all on biomarkers. We give you also email scripts for your clients. And so if you're an affiliate with us, what we try to do is make your life easier by helping you advocate for direct access testing. And again, you attach your affiliate link to these email sequences, and you can just send them out, to your people. We have a guide that we give people on the 5 pillars of aging well. It's just me and my wife here talking about the advanced biomarkers that we measure in the 5 key areas, and some natural interventions that they can consider. Again, it's an introduction. So the introduction is that we can measure how well a person's aging, and it's not done through one biomarker. Like all the rage right now in the advanced laboratory space is, can we develop one biomarker that will tell us how well a person's aging? Well, the truth is, no, we can't. There is no one biomarker that tells us. There's really key areas of the body that are working all the time, and they need to be working really well to slow down the aging process. And so by looking at these key areas of aging, we can assess how well each one of them is performing. And obviously, if we can optimize each one, that slows down the aging process dramatically. And again, I'm talking about biological age. So this begins to introduce them to that concept. Disclaimers, you may have noticed that I thought it was really cool, a lot of the stuff that was written for how we protect ourselves as health coaches and how we draw boundaries around our clients. And so we made those same disclaimers available to you as examples. If you want to download them from our site and use them on your own site, you're welcome to do so. We also have testimonials. Mitch Gaylord is an Olympic gold medalist who went through our testing process, and he wrote a testimonial for us. And we have testimonials you can download and use if you want to do those as well. So that just, sort of gives you some content information. The blog posts, big time content here if you want to take these blog posts and just post them with your affiliate link in them. Again, this is a way to help build your website, the content on your website if you have a website going, or if you just want to push out this information and hook your affiliate link to it. Again, once you understand affiliate marketing, it makes it so much easier, and I'm sure Carmen can really help you with that. Affiliate marketing is key to passive income for you guys. And again, it's really about advocating for things that you really believe in. Testing is a commodity. People can get testing anywhere. They can get it through their doctor. They can get it through many direct access platforms. And so the testing is something that everybody needs, right? And so it's a matter of, where do they go for tests? How do they get the test done? Where do people feel comfortable at? So I think it's just about, for us, it's pretty easy. People need tests. And so for advocating for testing is not a hard thing to do. But there may be other things that you feel strongly about. Maybe there's some nutraceuticals that you really believe in and so on. All these affiliate relationships are really important to building passive income to help support your business long term and to building partnerships with people. So this special offer for Carmen's group here is for the full transformation panel, the complete lab library, the optimal value lab cheat sheets, the custom landing page that we'll build for you. If you don't have a website yet, it's no big deal. We build it, we host it. I mean, you don't have to worry about that. All you need to do is send us your photo and a bio that's 250 words or less, and then we put it up. Usually within a week or so, we get it up. If you do finish our lab library and you want to take our test, you're welcome to do so. Once you pass it, then we give you the certification of completion that you'll get. So the cost on this normally would be transformation panel. You come to our website right now, buy it for $17.50. The lab library right now is $14.99. The cheat sheets are $249, and the landing page we build for people all the time for $299. People just want us to have that landing page. So it's all $3,800. But for your group, Carmen, you were the first group that we partnered with last year. And so we have the special affinity for you guys, and we really want to make it really reasonable for you. And so we had it at $14.99. And we also have some payment plans here, $275 for 6 months or $525 for 3 months. Once the payments are made in full, you get your lab requisition. You can either do the labs on yourself, or you can give them to somebody else if you want to. You can find the offer at yourlabwork.com Masterclass 014. So I'm just going to type that in there.
I got it already. It's already been put in.
Okay, got it. Okay, cool. And then if you have questions for us, you can always either ask Carmen or you can ask us at support@yourlabwork.com. If you want to talk to a real human being, my mom, I think, is currently staffing the phones at 1-855-FAST-LAB. That's right. I employ my mother.
I employ my dad and my sister.
Yeah. Well, my mom treats people just like perfectly. I love the way she goes to bat for people. Also, our chat box is available too at yourlabwork.com. We usually are monitoring that and checking that out. And then for your group, just when you go, this is like a special little add-on too for you guys. When you go and you check out, put in this coupon code YLW100. And if you do, you'll save $100 off that price. So again, instead of $3,800, you get your group will get it for $1,399 if they want to, including all the blood work and the cheat sheets, the lab training modules, and we'll build the custom landing page and get you guys in there as preferred affiliates. If you guys will just stick around for a second, I'm going to answer a bunch of questions, but I do want to just briefly go over the 5 keys to aging well here. So nutrients, what are the nutrients that improve metabolism? Again, these are the nutrients that improve the methylation pathway, really important, B12 and B9, which is serum folate. We also look at vitamin D to improve metabolism. Why? Because it improves insulin sensitivity, makes insulin work better. Omega-3s improve metabolism. Why? Because the omega-3s create a really flexible cell membrane, not one that's stiff and hard. So we really like to see flexibility because it leads to improved nutrient transport. And then finally, what are the 3 most common nutrient deficiencies? Omega-3s, 90% of people are deficient in those. We're all eating terrible. All the fast food, the French fries and potato chips and Pringles. I happen to love Pringles, so it's really hard for me to resist. Vitamin D, 70% of people are deficient in vitamin D. Magnesium, about 80% of people are deficient in magnesium. Again, vitamin D, by the way, is something when I say 70% of people are deficient, meaning they're below the reference range. Vitamin D has a huge reference range from 30 to 100. Mm-hmm. The studies say that most of the effects with vitamin D occur above 60. So you really have to get above 60 to get the benefits. When you take vitamin D, you should take it with vitamin K2. Because vitamin K2 will shunt all that calcium instead of to the arteries, it'll shunt it to your bones. And this is really important for women as they're going through, losing estrogen and that estrogen protection on the bones. It's super important for people that have calcium on their arteries, like my father-in-law. He needs to take vitamin D with the K2. It's going to shunt that additional calcium. Why do people have additional calcium with vitamin D? Because vitamin D helps them absorb the calcium. Mm-hmm. So if we understand sort of that pathway, we understand that vitamin D should be given with K2. Thyroid, how can you tell if you're at risk of developing thyroid disease? Well, again, we'll check antibodies, and you can see these antibodies coming. So what if my rest of my thyroid tests are normal and I feel normal and I have positive antibodies? Well, we're going to look at your total body inflammation. We're going to make sure your diet is completely rid of any anti-inflammatory foods, okay? Rid of pro-inflammatory foods. We want to put you on an anti-inflammatory diet. So we really want to get away from those things that would cause inflammation. About 20% of people with autoimmune thyroid disease will reverse. And so just because you have positive antibodies, it doesn't necessarily mean you're going to go on to develop thyroid failure, but 80% of people do. And so integrative doctors now are taking a more proactive approach for people that have positive antibodies, but who have not yet had symptoms or an elevated TSH or low T3. What are the optimal values? I told you guys this, your TSH 0.4 to 2, free T4 above 1, free T3 above 3. So those are my optimal values. Everybody has their different optimal values, but those are mine. Healthy blood vessels. What is the latest in blood vessel testing? I love the advanced lipid panel, and I've told you why. It includes lipoprotein A. Everybody should get this at least once in their life. It really tells you what type of good cholesterol you have and what type of bad cholesterol you have. And it does something called risk stratification. It tells us how bad our situation is. Now, I'm in a bad situation because of my father, who happens to be sitting right over there. Yeah, because my father gave me some pretty bad cholesterol genetics. And I know this because I've seen his cholesterol numbers. And he's also behind my issues with the ApoE. So it's one of those things where, again, your parents will sometimes give you things that if you don't know about, it'd be nice to know about them so that you can deal with them. Why wait to have an early event to get an advanced cholesterol panel? Because now that's what's happening. Cardiologists are not checking this unless a person has an early stroke or an early heart attack. Okay, so again, it's not being routinely checked. I think it should be. It's not a super expensive test. Yeah. All right, inflammation. Do you have evidence of chronic inflammation? Very sensitive marker is called HSCRP, or high sensitivity CRP. Again, if that's high, we worry about it. If it's above 2 in preventative medicine, it carries an increased risk for stroke and heart attack, independent of anything else, independent of smoking, independent of diabetes, independent of any other cholesterol issues, completely on its own. So we know that heart disease is caused by inflammation, it's caused by sugar problems, and it's caused by this small dense cholesterol, or Lp(a). Those three things together, the triad, the terrible triad of heart disease and stroke. Lab indicators of chronic inflammation, again, CRP, and then homocysteine. I am concerned about homocysteine in people that are higher risk. So if your homocysteine is above 10 and you have an ApoE3/4 or an ApoE4/4, like I do, I'm going to lower that homocysteine to optimal, which we talk about. And then metabolism, what are the essential lab tests for metabolism? Fasting insulin, I like to look at that because, again, insulin is super important for metabolism. High insulin equals very hard to lose weight. And many of my athletes who, they run all the time, they do all the right things, seemingly they just can't get rid of that last 20 pounds. Most oftentimes they genetically have problems with their insulin receptors and they have high fasting insulin. So those are important people for us to see and to treat. My optimal insulin levels for aging well, by the way, if your insulin level is really low, like less than 2, and you don't have diabetes, meaning your pancreas has not yet burned out, and you're normal, right? Your insulin, if it's low, that's usually a really good finding. Another good finding is usually if you have high sex hormone binding globulin. Most of my patients with metabolic syndrome have very low levels of sex hormone binding globulin. They're quite chronically ill. So those are the two biomarkers of longevity that I like to look at. So if I were to narrow it down to 2 real important ones, I would say fasting insulin and sex hormone binding globulin, with the understanding that if you're on any hormones at all, synthetic hormones, it will falsely elevate your sex hormone binding globulin. So those are my 2. All right, so I think we're at a good place to questions, right? All right, you're muted, Carmen, so I can't hear you.
Sorry, my mom had messaged me multiple times during the thing, and I was like, I had to answer her so she'd stop popping up in my window, and I put it in the chat accidentally. So if you see conversation to my mother in the chat, you guys, one sentence, I apologize for that. I told her I had a webinar going on today, and it just kept coming up. And your dad's in the room with you, right? Can you hear me, Dr. Allen? Are we frozen? Can anybody hear me, or can anybody hear Dr. Allen? Okay, Dr. Allen, I think you're frozen. Uh-oh, okay. Oh, you can, okay. Okay, yeah, he's frozen on his end. Okay, so let's give him a second. Let me see if I can chat to him. Great, okay, great, you guys, hold on just a second. Yep, he's coming back. Okay, just stay put, you guys, stay put. As far as the coupon code, I see you guys talking there about it not working. We'll make sure that that's taken care of when he gets back on the line. Let's give him a minute to log out and log back in. Sometimes that's what happens with technology, especially with if there's a lot of wind or cold or saturation, it can freeze up. So let's give him a second to hop back in. So I'll address a couple of things real quick. Hold on a moment. Let's see here. If you are in New Jersey and you are in New York or any of the states that do not allow you to order labs, and there's some questions in chat about this. So what you can do, if you are a person that has a business that works across state lines, say you have a business in New Jersey and you're not able to use this for yourself in your state, but you do work online with clients across state lines in other states that allow it, you can still make recommendations, become an affiliate, and benefit from this. So just because it's not legal in the state you work in, if you work outside the state online, you can absolutely still qualify to be an affiliate and use it, which I recommend. No, Quest does not charge a separate fee for the service that I'm aware of. I've used this service and I've never seen an extra charge. It comes all the way through your lab work. It is not available in Canada. So, but yes, absolutely. You can utilize this, becoming an affiliate using the URL. You can order place the orders and you can use them across state lines. We have people in Canada that have done that before. Still watching. DNA testing specifically to nutrition in relation to weight loss. I'm not sure about that. We'll ask him when he gets back on. Somebody kept asking about how long this program is. It's just a presentation and we're going to try to get some questions answered here. Yes, Anita, follow the replay if you're not gone yet. Let's see here. Still scrolling. Sorry, you guys. And let me speak to this, you guys. I just want to put this in some real language for you. What he's offering to you guys, a landing page, yes, it can cost $300 to $700 to get someone to create a landing page for me. You're getting information. I'm a health coach too, and have been for over a decade. And I can tell you that creating an e-guide, creating cheat sheets, creating a landing page, all the stuff he's giving to you, thousands of dollars if you hire someone to do it, or hours and hours of your time. And time is money. So the fact that he's offering this to you guys, you can't even put a number on what he's saving you in time to create this stuff, because I had to do all that myself. So 9 years ago, I wrote a thyroid book. I created cheat sheets. I did did the landing pages for my products, thousands of dollars. So don't underestimate what he's offering you in addition to those labs. It's beyond what you could possibly imagine. Let's see here. I'm from Australia. Is there a way I can access these labs from Australia for myself or my clients? I don't think they're in Australia. I don't. But if you work with people in the States, yes, you can. Zoom is really not doing us well today. I've never seen anything like this happen with Zoom. We've got everyone being called Dr. Allen. We've had loss of signal here. So I appreciate you guys hanging in there with this. The APOA1 being high, I think that is going to be an answer you're going to find in the training that he's offering to you guys, where he goes over all of the details. Yes, you can have too low cholesterol. I'm just answering this from experience, that when you guys remember that when our cholesterol is too low, we don't have enough to create the good hormones that we need. Hormones come from having enough cholesterol. So we can absolutely, I've worked with hundreds of clients. Many of them have had cholesterol that has been super low. And you'll see this in the aging population. Hold on a moment. I'm going to make sure that he's in the red over here. But that when cholesterol goes lower in the aging population, that's a red flag, because it's actually it's an anti-inflammatory. So, you know, our moms, our dads, people are being told your cholesterol is too high, go on a statin, but they're in their 60s, 70s, 80s, when really that's not good for them. So give me 1 second. I see someone raising their hand. There's so many things flashing on my side of things, you guys. Hold on just a minute. Oh my goodness. Dr. Allen, where are you? I don't know which one you are, because everyone looks like Dr. Allen. So hold on a minute. Hold on a minute. Oh my goodness. Dr. Allen, are you back on yet? Because I don't see your camera. If I saw your camera, I'd be able to unmute you. If I saw your face, actually. You're back on. Okay, which one are you? Let me see. I don't see I got to see your face to know which person you are. We're texting right now, so give me a moment. Where are ya? Hang on a second. I'm going to scroll through all your faces, and I'm seeing so many familiar. There you are. Hi.
Hey, all right.
You were like 40 people down the scrolling. You're back. Okay, great.
Yeah, sorry about that. No, I heard you answer a couple of questions there. So yeah, you were doing good.
Okay, good. I've had to do that on brain interview for 40 minutes before, when my brain expert wasn't there, and I don't know anything about the brain, really. So tell us about, hold on, let me see here. The code is not working. Someone's expressing concern. They cannot use the code.
Okay. I texted somebody about that. We'll get that fixed momentarily.
Okay, perfect. And do you want to speak to the too low cholesterol thing that we were just discussing?
Yeah, you know, the problem is I can't see the chats, the old chats. I just see the new ones now.
Okay.
So what were the cholesterol ones?
The question was, can your cholesterol be too low?
Yeah. You know, so we use cholesterol to make our sex hormones, among many other things in our body. So we definitely need to have our total cholesterol to be okay. You know, my perfect cholesterol number would be 150. It gives you plenty of room to make those things. When we talk about cholesterol, remember, it's not so much about the total cholesterol as it is about the type of cholesterol that we have. Some people have super high cholesterol, like, 250, but their HDL is 100, the good cholesterol, and they have mainly HDL large, which is the most efficient type of good cholesterol. So what we're literally looking at is the lipid subclasses. We're looking at LDL and the types of LDL that you have. And obviously, if you've already had an event, a stroke or heart attack or a stent or whatever, they want to drive your LDL number down very low. So I have a friend who's a doctor who, at the age of 47, he had a stent put in. He had peripheral vascular disease. And he had a pattern B, or small, dense LDL cholesterol, the worst type of LDL subclass to have. And so we drove his LDL down all the way to 30. Okay, got it super down, super low. And his total cholesterol was a bit low, like around 120 or so, but his sex hormones were still okay. So for most people, we can get away with driving down the LDL without driving down the total so low. But remember, everybody's different. So that's the value of actually testing and seeing individually where we're at.
Okay, great. Can you tell us about triglycerides? I don't remember you saying anything about triglycerides. And what are now I've heard, HDL at 70, HDL 70 or above, triglycerides 70 or below. What are your thoughts about the numbers on that?
Yeah, so triglycerides, they'll tell you less than 150 is normal. Less than 100 is considered optimal. I follow triglycerides mainly for people to hold them accountable for their diet, their nutrition. Because what happens with people is triglycerides are a byproduct of storage of really glucose, because what ends up happening is we eat too many carbs, and we store those carbs in our liver. And then when our liver gets full, we store the rest carbs in our muscle. Carbs are stored as glycogen in the liver, and they're stored as glycogen in the muscle. But in the fat, which is our eternal storage depot that we can just increase enormously, we store carbs as free fatty acids. And 3 free fatty acids hooked together are triglycerides. And so it's one of the ways that I actually look at people's carb intake. And so one of the things that we do is we say, look, you need to reduce your total sugars to less than 25 grams a day per sugar of processed food, because many people are eating 150 to 200 grams per day of processed sugar. So we try to get that down, because that's easy. Again, we're talking about most people. We're not talking about health optimizers that are paying attention to stuff. We're talking about the normal Joe on the street who just doesn't understand that when he go and he drinks a Coke that's a 20 ounce, that it has 75 grams of glucose in it. And you really want to teach him his daily intake should be less than 25. That's for a normal, healthy person, right? Okay. And so we follow the triglycerides over time to see if people are paying attention to that carb intake. Omega-3 fish oil, it just turns out, lowers triglycerides fairly significantly. And so the more omegas we take, the lower our triglycerides will go. Okay,
great. Okay, so let's go to the Q&A over here. We're going on almost 2 hours. I know that I have a hard stop at 12 o'clock today, so 12 o'clock Central. So Mary's saying, are the docs you shared earlier in the education portal, the Aging Wheel, the other doc, she's already an affiliate?
So the question was something about what docs is she talking about?
Documents, the Aging Wheel and the other documents that you shared, are those already in the education portal?
Yeah. So the Lab Masterclass is the education portal. That's what it is. Regular affiliates do not have access to the Lab Masterclass. The Lab Masterclass is a premium product that takes a deep dive into lab tests, and it is coupled with the lab testing. So we give the transformation panel plus the education process. And those people are considered to be preferred affiliates, and they get a higher affiliate share rate than a normal affiliate would. So if you became an affiliate for us, if you just went and become an affiliate, then you'll come in as our baseline affiliate, which is fine. That's 10%. So we do a 10% share for our baseline affiliates. Our premium affiliates right now, which are all Carmen's people, would be 20%. So you would get double the amount on people that you refer. Those numbers are sort of, I should say, rough numbers, because all the functional medicine tests we're going to roll out are going to be less because of they're just different contracts. And over time, those numbers can change. They typically don't go up. They may go down if somebody comes back to us and says they're going to increase our prices. But in general, we've held pretty steady to that. And we try to get people who have our masterclass. We just think they're going to be better affiliates, better understanding how the process works, and a better partnership over time. We give them a higher affiliate share. So you're put into categories, basically. We have 3 different tiers. We have the basic, we have the preferred, and then we have the premium tier.
Okay, great. And that leads to kind of the next question. I'm hopping around a little bit in the Q&A, you guys, but I'll get to them. What are the fees to the affiliates? I don't think there are any, are there?
No, there's no affiliate fees.
Okay, great. Okay, and do you know if Quest charges a separate fee for the service, or is that included with the labs?
It's included with the labs.
Okay.
And by the way, if people order these functional medicine test kits that we're going to have, we cover all shipping charges too. So we cover shipping to the client and shipping back. And again, you guys are complete, as health coaches, you're completely outside of the entire process.
Yep.
Okay. What you can do is advocate for your clients. You can say, hey, my client had this problem at the straw station or whatever, and, we'll look into it. And, that's, but in terms of like you guys ordering the test, you guys doing, any follow-up, anything like that, none of it you have to do. Think of it as just a completely separate resource. Think of it as a nutraceutical company where you say, hey, you should use this nutraceutical company. They're really good. They produce really good stuff that really works. Once a person actually purchases it, the whole process just goes. All right.
Right.
If you want to, advocate on their behalf, that's fine. In terms of affiliates, I think it's important for affiliates to understand how the process works. Affiliates, when do they get their money and how do they get their money? So affiliates get paid through PayPal. You don't necessarily have to have a PayPal account. I don't think. You just have to have an email. So you just put on your email where you, like, what email are you going to look at to receive your affiliate payment. We tend to pay affiliates once a person's blood work is actually drawn. So sometimes people order blood tests, but they never go in for the testing for months. And so we like to make sure that the blood work's actually drawn, because once the blood work is drawn, we guarantee that the blood work will be drawn. If for some reason there's a problem with the blood draw, we refund the people's money. But once the blood work is actually drawn and resulted, at that point we release affiliate payments. If the blood order is kind of small, like say they just came and they just ordered an A1C, oftentimes we'll just go ahead and pay the affiliate because it's not a huge risk for us, to go ahead and pay. But that's how that process works.
Okay, I want to answer this one real quick, Gina. I think Gina's asking. She says, if we're in a red state, we can't use it ourselves, or do we just have to check state rules about if we could order a lab test? Gina, it's not about nutritionadvocacy.org. I think that's what she's talking about.
Yeah, again, remember, you guys are not ordering the tests for anybody, okay? Mm-hmm. People are ordering the tests for themselves. You as a health coach are just providing a resource saying, hey, if you want to, whether you provide it as a written resource where you say, hey, here's my affiliate link. And by the way, if you use my affiliate link, you can use this $20 coupon. Because when people go to our affiliate resources page, they will find that they can get a $20 coupon that they can download for their client's first order. So again, it's a way to advocate for your client to, if they use your affiliate link, it doesn't cost them anything more. And by the way, they're going to save $20 on their first order. The physician actually orders the test. So the client orders it online, but the physician on the back end puts his or her name on the lab requisition and then reviews the results for any panic values. Okay. Health coach is not ordering the test, so it has nothing to do with the red state or not.
Right. Okay. Mary, when you're saying I can't work with people who live in those states, although I'm in California, again, those states are restricted from ordering from those states that he listed. And if you want to name them again, it has not, if you're in California.
It's New York, New Jersey, Rhode Island, and Maryland are the ones that restrict access to direct testing. And by the way, let's say somebody wanted to do glyphosate testing on themselves. They were concerned they were exposed to the weed killer, and they have it in their system. So they ordered a kit from us. Well, if they live in New York, they could still order the kit. The deal is that inside the kit from the lab company will be a form that they'll have to sign that says, I did not collect this specimen in the state of New York. Okay. And the deal is to be compliant, they can't actually collect anything within that state. I've had numerous people who live in New Jersey or New York who say, look, I'm just going to drive to a nearby state, or I'm visiting family over here and they have a Quest straw station. I want to do it. I have people in Canada, which, we don't offer labs in Canada because we don't have contracts in Canada, but they'll still order from Canada, and we'll have to call them up and say, hey, this is not going to work. You're in Canada. And they'll say, I'm going to travel across the border so-and-so, time or whatever, and see family. I want to get it done. So we've instituted a thing that when you order now, we actually put it in the state, and it'll basically knock you out if you're in Canada. So
okay. Let's see. Let me go back over here where we lost you. Whoever said they joined halfway through the webinar, yes, there are cheat sheets. So go back and watch the replay when it goes out, so you can hear all that great information about what he's offering. How often would you say clients need this service? I think it's going to depend on testing, but who goes over the lab results? Is it a doctor?
Yeah. So what we have is, so the way it works right now for anybody that comes to our website that orders any test, what we do is we send them out videos or educational videos of me. Let's, thyroid, insulin, cholesterol. We were just talking about an education, just video. Mm-hmm. If they want to visit with an integrative doctor who will actually discuss their symptoms and their lab test results and so on, we have partnered with a company that does it. It's Dr. Alan Christensen's group in Arizona. They have a telemedicine opportunity for people, and it's pretty inexpensive when it comes to integrative care. Integrative doctors, at least in Austin, very expensive, $500 to $700 an hour to talk to these guys. Online for telemedicine, these guys are offering it for less than $200. I don't know the exact price, but they're completely separate from us. We just wanted to have a resource for people that needed an integrative doctor that would listen to them in a different way and actually spend that whole time with them, instead of just a quick in and out visit, tell them their labs are okay. And again, it's an optional thing for clients. If they want to use it, they can. If they don't want to use it, they can always take their own test results and just, use the video and education that we give them. But the idea is that we don't want to we're not trying to get in the way of the physician-client relationship. We want people to take their labs to their physicians. What we're trying to do is save people money, number one, because for many people, that's all it is. It's like saving them money. And number two is for people that are really interested in their health, we want to lower the barrier for them to actually get their own data, and then they can take action on it. Again, the best thing about lab testing is it gives somebody accountability. Mm-hmm. And so, Carmen, if I were to test your blood and find out that you had lipoprotein A, you're much more likely to do the things that you're supposed to do because you're a little bit concerned about lipoprotein A once you understand it. Yeah. And that's the idea for most people that are into optimizing. They just need some guidance, and a lot of them love to self-manage. Mm-hmm. So they just want the info. They want the resources. That's me. I'm a geek like that. Okay, we've got someone from Australia interested in signing up to learn about interpreting labs and giving recommendations. Let's see here. She believes there are companies offering direct access labs there, but is it still valuable to her to do this training? And if so, how would she go about getting and using her own labs as part of the training? Yeah, so I don't know how she would get her own labs as part of the training living in Australia, because we don't have any draw stations there. She would have to come to the continental U.S. to do the labs. There would be something we could offer her to give her the education. We've done it for people all over the world before. They don't necessarily get the blood test, but they'll get full access to the cheat sheets and the educational library. So all she needs to do is email me at support@yourlabwork.com. and just tell me her situation, and then we'll make her an offer on what we could potentially do for her. We've done that before for people in various companies. Awesome. Okay, Carmen, if we purchase this program, should we also purchase your program you're offering on your website right now to help us set this all up with the labs? If you're talking about my lab training for health coaches, this is what you're going to get. It's two different views on everything, but I talk a lot about how to stay in your scope of profession, how to deliver information, safe information. There's a 52-page thyroid guide in there that you can use with your clients. So it's just really complementing what they're doing. It's a complementary thing. That's why we love collaborating with each other, because we do two different things. So yeah, I think it would complement what you're trying to do for sure. Dr. Ellen, I mainly have elderly clients. Is this option good for those on Medicare? Thank you. Yeah, Medicare is kind of funny, right? It's a rationing of care. And so, they only pay for an A1C, I think, once a year or something like that. So, yeah, this is definitely an option. We don't take Medicare. We don't take insurance at all, right? This is a cash-based discounted pricing platform. Right. So if they're willing to pay out of pocket, and we have many people who have Medicare that are willing to pay out of pocket because of the limitations in coverage of the Medicare lab costs. Which can be significant. Again, they're being charged higher prices by these lab companies too, and the lab companies just kick it back to them, saying Medicare refused to pay for this. I just had this recently with the A. Oh no! Oh no! No! Don't leave us again. We can't hear you. Medicare just refused to pay. Hello? Yeah, we're losing you. Oh, there we go. I'm back. You're red. You're red on my end, and you're frozen. I'm back. I can hear you. Oh, okay. There you are. You're moving. I can. Okay, I can hear you. Okay, good. Yeah. Okay, good. All right, let's get through these questions, you guys, in the interest of time here. We've got about 10 minutes left. Does lipoprotein B cause concern, or just lipoprotein A? Yeah, so apolipoprotein B is the protein covering on all the bad cholesterol molecules. So it covers all your LDL, all your VLDL, which is very low density lipoprotein, and of course all the LDL subclasses. And so I think of it as like
Hang in there, guys. Hang in there. We'll hear him again in a second.
like you have a baseball team, apolipoprotein A caps if they're the bad players. Oh, am I out?
Yeah, we've got some major stuff going on today. I don't know. Hold on just a second. You're red again. Your signal is red on my end.
Oh, I'm back again.
Yep.
Okay, I'm back. Can you hear me?
Yeah, I can, but you're still red, so. Yep. Okay, go ahead. Just keep talking.
I was just saying that ApoB is a cause of concern because it simply is a measurement of all the protein covers of the bad cholesterol molecules. And so that number, we'd like to see less than 90.
Okay. All right. My concern, Mary says, is when we've got some names over here, but is when patients take lab results to their doctors, the doctors will tell them not to pay attention because they don't understand them, that believability will suffer.
Yeah.
There's some skill in that. There's some skill in dealing with that for sure. Yeah.
Yeah. And this is why I actually put out the cheat sheets and I encourage people to get them laminated and even give their clients copies of them with things that are circled to talk to their doctor about, because it really does put that resource into the doctor's hands. And if the doctor doesn't know about it, yeah, they might poo-poo it. They might. I mean, I know that there are doctors out there that don't, when they don't know, they immediately assume that, there's no credibility to it. But it's all research or evidence-based. So, it's actually good information for that doctor to have in front of them as they work to treat the person, in a very comprehensive way. Many of the treatments that we put on the cheat sheets, by the way, I mean, all the treatments on the cheat sheets are natural treatments and information that people should know if they have that biomarker out of whack. I mean, it's really good thing to know how to increase HDL cholesterol. How do you properly increase HDL cholesterol? What are the great things to know? Well, you got to stop smoking. That's going to raise your HDL. You know what? You got to lose weight because we know that'll increase your HDL. Taking omega-3 fish oil, that'll increase your HDL. And we know that exercise, particularly high intensity training, will increase your HDL. So what's wrong with having those 4 very natural things to know about? I mean, if that doctor doesn't know that, I think it's great for that doctor to know that. So you just take the cheat sheet in there, it's circled, hey, I'm concerned about these things. These are some of the things that I've been trying to institute naturally. What do you think is my overall treatment plan? Again, it's providing them really good information as a resource, increasing your value. And again, this is a commodity. It's not like anybody's going to argue with lab tests. Lab tests are what they are. Some doctors don't believe in optimal. Some doctors do. I mean, that's just the truth. Many people will not treat anything until it's a disease.
Right. And let me just add on to that, these people are getting these labs done. They're not getting these labs done and just going to the doctor. If they've hired you, this is the area where you guys are supposed to be focused on the pieces that the doctor doesn't have the time to do or doesn't understand. So even if they take the labs to the doctor and the doctor says, oh, that HbA1c of 5.4 is fine, unless it's 6.0, we're not worried about it. You can actually say, if you're concerned about it, let me give you some suggestions and recommendations. Like, you're not there to run in between it like he's saying, but you can make suggestions. And then it's always going to be up to your client, you guys. Don't take accountability for the decisions that they need to make. You're there to provide support and empowerment and inspire them, but you can't make them eat, drink, or poop. So give them the suggestions like he's saying and then leave it up to them. There's a lot of accountability stuff going on with health coaches where they think that they fail if they don't get the client to get to where they want to be and all of that. So I'm really trying to put a damper on that also here lately.
Oh, yeah. No, I think it's really about providing your client the resources and giving them good educational information and then just advocating for them in all aspects of their life, whether it's, exercise or spiritual or, whatever it is, you take a stand for that person. I mean, that's where you make a huge difference.
That's right. Yep. Okay. Let's see here. Your suggestion for lifestyle recommendations and nutrition for APOE4.
Yeah, I would encourage her to go to the Lab IQ and watch the entire interview with Mark. He's an integrative doctor, but it's one of the most viewed videos that we have on Lab IQ, the private Facebook group. So if you haven't joined that, watch that. It's not a quick question to answer. He does a really good job though of explaining and giving it context and why it's important.
Yeah. Okay. Mary's asking, can you test thyroid hormones if you have an IUD? Of course. I mean, that has nothing to do with down that area, right?
Yeah, no, and I mean, intrauterine device is more just, it's releasing hormones in there, but it doesn't mess with the thyroid. So.
Okay. All right. I think we got through it all. This is, your client's doctor needs to revisit the endocrine system because, yes, absolutely. You can test thyroid. Okay. And hold on a second. I think my dogs are about to bark. Is there anything you want to wrap up with? Because someone just walked in my door.
No, I mean, just if anybody has any questions, they're welcome to talk to Carmen. Carmen's very familiar with the process, and she advocates on behalf of her people. We've tried to bring you guys the absolute best deal that we have on this right now, so that you guys are actually getting the transformation panel on all this stuff at the lowest possible price. It is not lower than this anywhere, and so you guys are getting a fantastic opportunity to partner with us to build your business. But more importantly than that, this is really good lab to actually get on yourself or a loved one. So we do allow you to gift a lab requisition. If you were to look at this for the lab costs alone, you're getting a really good deal. I'm not trying to sell you on, I'm just telling you, you're getting a really good deal through Carmen. So I think that's fantastic. She's advocating for you guys. She's going to be a great long-term partner with us. We're really there to support her work and what you're doing with health coaches. Me coming on and doing educational stuff, I want to continue to do that. And so all that will continue. This is just a special opportunity for you guys if you want to take advantage of it. And we try to put payment plans in there so that you could reserve your price at this lowest price that we have for some people that may be looking at this and just not quite ready for the full amount. As soon as it's paid off, then we give the lab requisition. But we do give you immediate access to all the educational materials, and you can become an affiliate as soon as you make the first payment. When I say affiliate, you'll be the premium affiliate.
Yeah, and I just want to add this on here too, you guys. I get all the same feeds you do and all the same marketing comes to me, all the health coaching training and all of that. But let me just say this, if you have been considering learning or going to a school that teaches labs, you're looking at thousands and thousands of dollars for education, anywhere from $3,000 to $9,000 is what I've seen. And then you're looking at 6 months to 12 months of training. And then you're looking at how are you going to learn how to deliver that? You'll have to come back to me because I'm pretty much the only person that's going to teach you how to deliver that information in a safe way so far that I've seen. And this is, what did you say? $12.99 with that $100 off for everything you're offering.
It's actually $14.99 with $100 off. Yeah.
Okay, my bad. $13.99 total. Yeah, I used the coupon and it's working now, as we've noted in the chat. But I have to say this also, as we're getting more mainstream as health coaches. If you are practicing in a safe and sustainable way, this is about the only way you're going to be able to do that with labs. Otherwise, you're looking at all, like, again, all I said, those programs and the trainings and all of that. And then you're probably going to get a little nervous about how to do it. This is just you sharing a link to help people, take more control of their health. It's no different than saying, oh, you were told you have leaky gut. You want to know more? Here's a URL for that. Same thing. You're not talking to them and prescribing and diagnosing them with leaky gut. You're giving them information to get their own information to share with you. So, yeah, go back and watch the replay if you're asking how to do all this, you guys. We covered in 1 minute, it'll be 2 hours of information. So replay will be going out as soon as we can get this to our team. There is a deadline, right? There's a deadline on, you had a 24-hour something on the landing page. Let's repeat that.
Yeah, I think it's 48 hours on the landing page.
Okay.
Just give them a little time to think about it. If they want to have that bonus, then we'll build it for them. In terms of the whole offer, we have 5 days, for them to decide.
Yep. Okay. How long is the training too? How long will it take to complete?
Yeah. So if you want to go through the training, most people, depending on their prior history with understanding labs, it'll be anywhere from 10 to 15 hours worth of actual sitting through the stuff. And again, it's a combination of videos, which mainly are video summaries at the end, but it's going through each and every biomarker and learning what that biomarker is testing, what the optimal values are, what's the controversy behind the biomarker and how it relates to maybe other biomarkers, and then how to easily explain it to people.
Yeah. Yeah.
So that's kind of it. Somebody asked, how often do I recommend comprehensive blood work? I do it on my patients once a year. And again, these are people that are, they are willing to invest in their health. And so, I mean, your health is typically something we don't invest in, and we just always get upset when we get a health bill because we feel like we shouldn't get one. But it's something that we don't invest in, and we're only upset about it when we don't have it. And so the idea here for most of my clients they're very proactive. And so they want to take the bull by the horns, and they want to age, well, and they don't want to run into an early event. And that's why they will pay for lab tests that are comprehensive. And they do it about once a year.
Yeah. And I'm the same. I do the big daddies once a year, and then every 6 months, some of the smaller ones as well. But oh, there we go. My husband's paying for it now. Yeah. And again, you guys, you don't want to wait for the heart attack before you go running labs and find out what, obviously, you know, there's something wrong once you've had a heart attack. I mean, you know, so prevention is really all it's about. And again, you know, just remember this, you know, you are able to use this with anyone. It doesn't have to just be with your clients. It can be with your friends and family too. So I've already told my mom and dad, when I come into town next week to close on my house, we're going to sit down and we're going to look at your lab work, and we're going to go through and we're going to pick some things out that I want to see on the both of them that I haven't seen in a while, because I'm their health coach. So we're going to go in there. We're going to do some more in-depth looking at the APOE and the lipoprotein A and all of that as well. So don't forget that there's an untapped resource with friends and family as well.
Yeah. And Mary, there is no monthly fee to keep the landing page. That's something that we just keep ongoing on our site. We have a pretty good technical team that just keeps that going for us. So.
Yeah. That's a huge deal. We had people asking last year, remember? They were like,
yeah,
they go to my page and they're like, how did you get such a fancy landing page? I want that. Well, now you're giving it to them, right?
Yeah. Well, we really wanted to make it easy for health coaches to be affiliates, and we wanted to, you know, add value to what they were doing, because we really felt like they would be a great resource to, you know, just tell people about it. And again, for a lot of people, it's just simply a financial decision. It's just a way that if they have a high deductible, they want to save some money, or they just want to get their own tests without having to see their doctor first. And, you know, maybe they're, you know, it financially just makes sense for a lot of people. Yeah. But there are people out there that just love the fact of being able to go and get their own blood work done. And then they decide what they want to do with the results. That's right.
That's right. Okay. Well, you know, I can't thank you enough for coming to us and bringing us all this amazing information. And just, I mean, you guys, again, go back, watch the replay, go out and look at the page. I mean, do some math. Figure out what you would be spending if you had to do all of this or do it anywhere else. And I'm talking about the cheat sheets and the time it takes to write the guides and the landing page and all of that. I have not ever, and I can honestly say this, ever had anyone offer this much value ever. And I've been doing this since 2013. I've been collaborating with people, as you know. I mean, I have almost 100 interviews with experts that you and I know well from Mindshare. No one's ever done anything like this before. So even just from my side of things, I appreciate you speaking to the health coaches and knowing how valuable we are. It really means a lot to me personally. So I appreciate you.
Yeah. Well, thank you so much for having me. Sorry about the internet issues and Zoom, but you know, it is what it is.
That is what it is. And we got it done. So I'll be in touch with you also, because I've got a couple ideas for bringing training in to our people. And, you know, we'll talk soon. And tell Amy Beth, thank you for sharing you with us for so long. We appreciate it.
Okay. All right. You guys have a great day.
All right. Thanks, everybody. All right. Bye-bye.